Okay. Okay. So that's me, Dr. Vidhya Pereira. I am practicing for the last 14 years in and I'm very happy to see all of you all. And yeah, so let's just start. What are we talking today? We are talking about geriatric dentistry. Okay. So what is geriatric dentistry? Can you see these seniors? They have such lovely smiles. Their eyes bright, beautiful, lovely teeth, and confident. Okay. So what is geriatric dentistry? Geriatric dentistry is the delivery of dental care to older adults involving the diagnosis, the prevention, the treatment of problems associated with normal aging. Can you see this lady is biting into a juicy apple? Yes?
Vidya, I have to change the slide.
Right.
You cannot see introduction?
No, we can see slide number 1.
Now?
No. Click on the second slide, no?
Now?
No, still the first one.
No? Okay, I'll go back. Huh? I think I'll keep the...
Sometimes this happens. You've done a slideshow, then stop the slideshow and you just it may be able to progress.
Okay, so we'll do it from here then.
Yeah, okay.
Okay, see the second slide.
No, the first one only.
No, still the first one. Yes, yes, now the second one's come on. Oh.
And we're back to the first.
Okay, now?
Second one, yes, perfect.
Okay, yeah, so this is the introduction to geriatric dentistry. I would like to ask many of you all present here, when was the last time you all went to your dentist? Was it like 3 months back, 6 months back, a year back, or maybe you don't even remember? Yeah. So as we age, as we are 60 plus, we tend to neglect our oral health. We tend to neglect our oral hygiene. Eat delicious and nutritious. Mouth healthy is essential, and a clean mouth is a gateway to a clean and healthy body. So all these things we have to remember. As we grow older, our teeth are also aging. Are we taking good care of our teeth? Are we going regularly to the dentist, or are we neglecting it and keeping it as a second thought or an afterthought? My children come first. My work in the house comes first. And then slowly and slowly, you just totally forget about it. So this shouldn't be the case. Concerns regarding you. Your mouth is a gateway to your body. Research has shown that infections in the mouth may be associated with heart diseases, stroke, diabetes, pneumonia, etc. So a few sign symptoms related to oral conditions I would like to just touch upon. The first is dry mouth syndrome. So what are the signs and symptoms which we see in a dry mouth syndrome? Okay, so if you are experiencing dryness of your mouth, you're experiencing burning sensation in the mouth, if you're experiencing the corners of your mouth cracking up, if you feel that all the time I have to just sip water, these are the signs that you may have dry mouth syndrome. What are the causes of this dry mouth syndrome? It is mostly linked to the medications that you are taking. As we age, our list of medicines goes on increasing, and there are a lot of side effects with these medicines that we take. Any medicines which we are taking for asthma, Alzheimer's, Parkinson's, high blood pressure, one of the side effects is dry mouth. So what can we do to reduce or alleviate this syndrome? Can we change the drug? Maybe you can go to your physician and tell him that this is my problem, and can you change the drug, or can you reduce the dose of the drug, or certain tips which I can tell you to reduce dry mouth syndrome. Okay. Yeah. So these certain things we can recommend. Use a standardized mouthwash daily. So you are brushing twice, morning and night. You are using a mouthwash in the morning after you brush your teeth. You take around 5 ml, you gargle your mouth, and then don't have anything for the next 5 to 7 minutes. Drink more water. Now you can sip water. Keep a bottle aside for you and sip it as and when you feel thirsty. Thirdly, you can also chew on your sugar-free gums. Like, you know, in the market you get xylitol, containing xylitol, which stimulate the saliva. Avoid carbonated soft drinks, your sodas, Limcas, Pepsis, all these are carbonated soft drinks. Acidic fruit juices we should avoid. And of course, you should go and meet your dentist, who, if the case is severe, can also recommend a fluoridate or a varnish, which can protect your teeth. So this is for your dry mouth syndrome. Next condition we often see in our senior patients is gum diseases. So as we grow, our gums become spongy. We have periodontitis, we have pockets, we have plaque, we have calculus getting accumulated. Okay. So if it is left untreated, gum diseases can cause gums to pull away from the teeth, cause pockets, and more destruction. Eventually, this destroys the gums, the bones, ligaments supporting the teeth, causing the teeth to become loose. So what I would recommend for gums, okay, you're doing your mouthwash, you're doing your brushing. One thing you can also add for your gum health is massaging your gums. You can use any kind of a gel like Dento gel or a Mucopain or Metrohex gel. And how we massage our head? We have a head massage once in a way. So what does that do? It increases the blood flow into your gentle pressure, massage the gums. So what will this do? It will increase the flow into your gums and make them more healthy. So these are small tips which I can tell you, and you can jot it down somewhere. Now, seniors, how many of you all have diabetes?
Hi. I think Dr. Vidya just got kicked out of the session because of poor network. We'll just wait a minute and we'll wait. Let's see. Oh, there you're back.
Yeah. Okay. So I have to screen share again.
Yes, yes.
You can see the slides. Okay.
Yes.
I was asking everyone how many of you all have diabetes, because that is the one disease that is very predominant for age group 50 plus. So diabetes patients have to take a lot of care when it comes to their dental health, when it comes to their teeth, their gums. Okay, so a diabetic patient should be more conscious of their dental health. Any minor infection can flare up and cause a serious damage. Gum diseases are also common in diabetic patients. Okay, so Your timely check for your blood is very important. Things to remember. Get a dental cleanup done once in every 6 months. Can you hear me?
Yes, we can hear you.
Okay. Opt for a morning appointment. If you're going to dentist, opt for a morning appointment. Your sugar levels will be stable then. Take your medications, including and antibiotic a day prior in case of any invasive treatment. Okay, this you should always ask your dentist. I wouldn't recommend that. When you're going to your dentist, you have to take your file, your medical file. Whenever you go, so many come to me, I have some allergy of some disease, some drug. And okay, which drug you have allergy? You tell me, I will I don't know what drug I have allergy. So when you have that allergy of certain drug, you write it down. You write it down on your file. Okay, I have an allergy to this drug. And when I go next, not only to a dentist, maybe even a physician, you must always tell them about it. You must show your list of medication, any blood thinners, you are taking any blood thinners before an extraction, we have to know about it. Ecosprin, Clopitab, any kind of blood thinners, please tell your medical history first to the dentist. Okay, so mouth cancers. Why is the dental appointment very essential every 6 months? Is because when you go to the dentist, if you have any lesion, red and white lesions in the mouth, or under the tongue, on the cheek, it can be detected at an early stage than rather later. So just 2-3 months back, we had a patient and she had come only for an extraction. 65-year-old female patient, Pushpa, she had come for an extraction. Her tooth was very mobile. So we were worried, like, why this patient with no other history is having tooth mobility. We just checked her. We saw a small lesion just buccally to that tooth which was supposed to be extracted. And it was not something that was regularly seen in the oral cavity. So I recommended her and I told her, I just sent her to GDC, to a colleague of mine. And I said, okay, you just get it checked. We don't know what it is. So we just, to be on the safer side, you can just go and get it checked. So lucky for her, she got it checked on time. And sure enough, it was squamous cell carcinoma. And the patient's husband called me a few days back and told me, we are very thankful to you, doctor, that you have diagnosed and caught the lesion at a very early stage. And we could, win a surgery of her bone, we could just skip the worst. So dental checkup can, spot such small lesions and save lives, as it is written here. So some symptoms you may see include open sores, white and reddish for more than 2 weeks. Okay. So normally an ulcer, if you get an ulcer because of some deficiency, vitamin B deficiency, some trauma, will you heal in 2 weeks? If it is not healing more than 2 weeks, you should visit a dentist. Okay. So another few things I would like to stress upon here is as we age, a good thing I've seen in the last few decades is mobile and we extract and we put a denture. No, now many old patients, even up to 85, I have seen, are retaining all their 32 teeth, which is a very good thing, very good news. But bad news is we are not taking care of those teeth which we are retaining. We are taking good care of those teeth. We are not taking oral, there is a lot of infection. There are other things. So that is the bad news. There is good news and bad news. So dental caries is common in cases of patients who now, as of now, are not able to brush their teeth properly. Maybe they have some kind of disease, coordinating motor diseases like Alzheimer's, Parkinson's, they are not able to clean their teeth. So the caregiver in this case has to take it up, take the onus to clean the teeth of such patients. Okay, I'll show you some slides here. Okay, so a few steps can go a long way, like your brushing and flossing. Okay, so I have some aids here. Can you see these? This is called an interdental brush. Okay, so as we age, the gaps between our teeth increases. So they are the interdental places which the space increases. Your brush cannot easily go there. So this aid is an interdental brush which is used in between the teeth. After you brush, you can use this to clean out any food that is stuck. You can also get something like this Unifloss. It's a box of like a toothpick with a floss. Okay. Then, of course, a floss is a must-have for everyone. Flossing removes any kind of plaque or food debris in between. So you brush in the morning, you use your mouthwash, you floss, and of course you massage your gums. Okay. Now, replace your toothbrush every 3 months. If you had COVID in the last 3 months, please throw out that brush. Okay, so the latest studies are showing that the virus is still there on your brush. So it is best to throw away your brush as well as whosever brushes were together in that same container. Okay, so these things we must remember. Okay, your brush, what type of brush should you use? Usually we recommend a soft or a semi-soft brush for a senior patient, not a hard brush. Because if you use a hard brush, it will use cause adhesions and it will just cause. So a soft or a semi-soft brush, or use the Oral-B, any kind. But use it in the right way. You have to time yourself 2 minutes, 2.5 minutes. If you cannot think of how to brush your teeth, you have to use a round circular motion. Start from one end, round circular motions till the other end, and also brush the tongue. If you're using a tongue cleaner, that is okay. If you cannot, it is also advisable. Many of the brushes have a tongue, a kind of a rough opposite side, so you can clean your tongue with that. Okay. Okay, so it's along with your brushing, which you can use, this is called a water pick. If a patient cannot now brush his teeth, this is a machine, it's an electric machine, which you get with the force of the water. All the debris around and interdentally under your bridges and all can be cleaned. This is floss again, and it's for a person who cannot, like a motor disease, someone like Parkinson's, he cannot hold small tiny things. So for him, you can modify the brush in some way like this and help him or her to use it. Now, so many of you may have partial dentures, full dentures. Okay, so you should take care of your dentures, clean them daily. After every meal, you should clean them, take them out, and for at least 4 hours every day, take your dentures out, keep them out. For your gums need breathing space and they need little oxygen. So that will help the gums, and denture should be replaced every 5 to 10 years. So this polydent is a kind of a denture cleanser. Other options for loose dentures. Another option for loose dentures is an implant supported denture. Okay, so now with latest technology, there is no more only option is only to remove all your teeth and have dentures. There can be many options like implants are now in dentistry for more than 30 years. So implants, basically, what is implant? I hope you all know, many may be knowing about it. Implants are basically titanium screws which are surgically inserted into your bone, okay? And after maybe a month or maybe 1.5 months, the prosthesis, maybe a denture or a bridge, can be put, taking support of that implant with a screw. So it is called an implant supported, either a denture or an implant supported bridge. So if you have few teeth missing and you are not happy with your denture, it is irritating, it is ill-fitting, you can always go to your dentist and ask him about this new technologies about implants, which is something that like a fixed bridge, which was not there previously in the market. So yeah, so as I told you previously, when you visit your dentist, bring the following information: the list of the medications you are taking, okay, any platelet thinners or like an aspirin or ecosprin, all the list of medication conditions like allergies, any surgery done in the past, yes, last 6 months. If you have undergone angioplasty, angiography, any kind of surgery, major surgery, should always be told to the dentist. And of course, any placement of a pacemaker, very important. If you have a pacemaker placed, you have to inform the dentist before the scaling and polishing of your teeth are done, because those vibrations can interfere with the vibrations of the pacemaker. So these things we have to just keep in mind. So again, in place of a plain, a regular denture, there are new things like a click fit, like a flexi denture, which doesn't have metal and it is all made of plastic. It is light material, is imported. So flexi dentures are now taking up more, is recommended more than your normal regular dentures, which are quite heavy and quite stiff. Okay, so you can also ask your dentist about flexi dentures or click flicks. And of course, dental implants, I've already told you, they are small pins placed in the jaw. And you can go on for this option. It looks something like this, like an implant screw. It is a titanium screw. It is put into the bone surgically. Before the surgery, the doctor will ask you if you have any medical condition, and also many tests will be done before the implant is placed in the mouth, like an MRI, a small MRI only of your teeth to see the height of the bone, how much bone is there for this implant. Can we place an implant? Can we not place? Not every case is recommended for an implant. Okay. Any questions on all these topics? Anyone has anything to ask?
Thank you, Dr. Vidya, for that.
Okay, so my last slide, smile has no age bar. Okay, so everyone can have beautiful smiles, even at the age of 60, 70, 80. There is no age limitation to what the modern technology can do for you, okay? So I'm sure with this topic, I have at least motivated many of you to just take an appointment at least with your dentist, okay? So yeah, thank you so much, Sheldon.
I'd like to ask you a question, doctor. How do you
Yes.
massage your gums?
Yeah. Okay, so we have certain tubes available in the market, like a hexi gel, okay, or a metro gel. You take a little gel in between your fingers, and you put one finger inside and one finger out of your teeth, and you make circular motion with little pressure. Okay, so that way you're massaging your gums. Okay, up once and down once too. Keep the gel for around half a minute, and then you can just rinse, gargle. Okay. Another tip I can give you is when you're just some nutritious food, you should always have. Now, as we age, 40% of our taste buds are depleted, 40%. So the taste sensation is highly reduced in senior citizens above 70. Now, if you don't have taste, you're not going to eat the nutritious food that you usually would have eaten when you were a younger person. So now you have to make an effort to eat nutritious food. Lot of salads, make slices of carrots or cucumbers and just munch on these hard raw vegetables. That will also cause like an exercise for your gums and also give a nutritionist value to your body. Okay, so that is one thing. And yeah, any other questions?
Can I ask a
Why do
question?
you brush your tongue?
Can I ask a question,
Why do you
please?
brush your
Doctor, can you exit
Why-
screen, view screen, please? Yes, yeah. So that everybody can see you then. Okay,
Yes.
excellent.
And why do you brush your tongue? What's the idea of brushing your tongue?
Okay, so on your tongue, if you feel your tongue is not absolutely smooth, okay, there are a lot of fibers up and down. They are called your taste buds, okay. Now, in between those ups and downs, there are a lot of spaces, okay. In these areas, your saliva is stuck, and with time, it becomes thick. And wherever the saliva is stagnated, there is always a ingrowth of microorganisms. Yeah. So when you're cleaning your tongue, you are removing all the dead cells. You're removing the thick saliva which is there, and along with that, all the microorganisms and germs.
Okay, okay. Thank you.
Can I ask a question?
Yes, sir. Yes, Lalita.
I would like to.
Could
I
you
would like
tell
your-
us something about
Okay.
Uh,
Is a plastic tray. Many patients have a problem of locked jaw. You know, when you move your jaw, you can feel this joint. It is called the temporomandibular joint. Yeah. So as we grow old, the muscles holding this joint also become old and weak. So your lower jaw is very loose. So sometimes you can get a locked jaw, means your jaw is locked in a place. Okay. Now to just relax these muscles, we give a night guard. It is like a transparent tray which you put in the mouth, and you can use it in the night when you sleep. Okay, it is also given in cases of bruxism. Okay, what is bruxism? Bruxism is a disease when we tend to grind our teeth unknowingly in the night when you are grinding. Maybe you don't realize, but your neighbor will say, "What man you're grinding? You're making so much noise in the night." Crack, 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 crack. So that means you have bruxism. Okay, so or maybe you are too much stressed. You keep clenching your jaws, all the time you're doing that. So all the pressure is coming on all these muscles, the temporomandibular joint. Okay. So to relax this and give it a break for a few hours, you wear this night guard in the night. So the muscles are relaxed, and in the morning you don't have any pain in your joints. So that is the idea behind a night guard.
Does that cause discoloration of the lip?
No, it doesn't cause.
No.
It is just a plastic tray. Okay. And you have to keep it clean. You have to wash it in the morning with your normal brush under running water, and then put it back in the next night. You can change it after 3 months. If you see it is, worn out, you can change it.
Thank you.
Thank you. Any other questions? Can we go to the next?
Can I speak?
Yes,
Doctor?
Lalita, is that you?
We would like your, doctor, we would like your, yeah.
Yeah, okay.
Doctor, we would like your address and phone number, please.
Yes, sure. Shaldev will help you. We'll put it up on the group.
I'll share doctor's address and phone number on the